Student Health Insurance at the McGeorge School of Law. Let's go over plan basics and frequently asked questions. First, when you have questions about insurance, you should contact the insurance office. We're here to help you. Our office is open Monday through Friday, 8:30 a.m. to 5 p.m. Our phone number is 209-946-2027. You can also email us at insuranceoffice@pacific.edu. Our website always has useful information, including the insurance brochures. Navigate to www.pacific.edu/insuranceoffice.xml to see what is available. The most common question we get is, how do I enroll in the Anthem Blue Cross PPO plan? For students registered in 6 or more academic units, enrollment is automatic if you do not complete a waiver by the posted deadline date. If you are enrolled in less units, you can actively enroll via the Wells Fargo site. To find the enrollment application, go to our website at pacific.edu/insuranceoffice.xml. When does your plan start and end? Each year the plan begins on August 1st. The fall insurance semester ends February 1st, so if you graduate in December, your insurance will remain in effect until then. The spring insurance semester is February 1st through August 1st. Again, if you graduate in May, your coverage is in effect until August 1st. What about your spouse, domestic partner, or children? Can they get this coverage? The answer is yes, and they would have the same exact plan benefits as you, but the cost is quite a bit more. For current costs, refer to the plan brochure. For your children, you pay the same rate for 1 child or for 10. If you have a baby, you have 30 days from the birth of the child to enroll them in this plan. After that, you would not be eligible to purchase the dependent coverage until the next semester. You will enroll them directly with Wells Fargo at 1-800-853-5899. You've now seen how long the coverage lasts, even if you graduate, but what happens after that? Hopefully you'll have an employer that will provide health insurance, but if you are still studying for the bar exam, there is a continuation plan available to you for either 3 or 6 months. Refer to the current plan brochure for costs. Choose wisely, because if you choose a 3-month plan and later decide you needed 6 months, you will not be able to add the 3 additional months. If you want something shorter or longer term, your best bet will be to do a search online and get a few quotes from other insurance companies. Websites like ehealthinsurance.com allow you to get quotes from multiple companies by providing your information once. You have 45 days from the termination of the regular insurance plan to enroll in a continuation plan. Enrollment occurs directly with Wells Fargo. How do you get your insurance card? Your coverage begins in August, but it will normally take until the 2nd week of August to get your insurance card. If you need the insurance information sooner, contact us at the insurance office. We can email you a paper version that has all of the pertinent information. The Academic Affairs Office also can print a paper copy for you. Make sure you always update the registrar's office with any changes of address. Otherwise, your insurance card may go to a permanent address or the last local address that was on file. Where can I receive medical care? Believe it or not, there are services offered right on campus. You can use the Silver Acre Clinic to meet some of your healthcare needs. A nurse practitioner is on campus on Wednesdays from 8 a.m. to 12 p.m. and Thursdays from 8 a.m. to 5 p.m. They are located in Silver Acre Apartment 1. Since there isn't a waiting room, you have to call at the gate to be buzzed in. Walk-ins are not available due to constraints of the space. To book an appointment, call 209-946-2315, option 1. The fee is $120 per semester, which allows you to be seen at counseling services as well. It gets charged to your student account and you can pay through the business office. By paying this fee, you do not have to pay an office visit copay at the clinic. Services are covered at 100% and medication copays are just $10. To use off-campus services, just go to anthem.com/ca and search for a provider of your choosing. We highly recommend determining which hospitals and urgent cares closest to you are in network, so when you really need the services, you don't have to stop and look online. Okay, so now you know that services are available on campus, but what can they help you with? Primary care management, health screenings, women's wellness including routine pap and pelvic exams, contraceptive services, pregnancy testing, HIV testing, STD screening and treatment, lab services, medication services, referrals, immunizations, TB screening, INH prophylaxis treatment, work treatment, study abroad, athletic, and pre-employment physicals, the nurse advice line for after business hours, and a registered dietitian services offers phone consultations. This is a PPO plan, but do I need a referral to see a doctor off campus? No, you don't need a referral. However, there are times when a specialist will want you to have a referral from a primary care doctor. You can either obtain one from the clinic or from your own in-network primary care physician. Our vision and dental part of this plan? Vision is included at no extra cost. All benefits that I will now list are in-network. Please refer to the plan brochure for additional benefit details and the out-of-network rates. There is a $20 copay for routine eye exam. Anthem will pay up to $130 for frames, then 20% off the remaining balance. There is a $25 copay for lenses, then the balance is covered in full. Elective conventional contacts have a $130 allowance, then 50% off the remaining balance. Disposable lenses also have a $130 allowance, but there is no additional discount after that. Dental is unfortunately not included in the plan. Go to studentinsurance.wellsfargo.com for options that Wells Fargo has provided, or you can do your own search online. Now, let's go over some benefits of the plan. Please note that this will not be a comprehensive list, and exclusions and limitations to certain benefit categories do apply. This list is not a guarantee of payment. There is an annual deductible of $100 per person. That is the amount you pay before the insurance starts paying. There are some services where this is waived. For an emergency room visit, there is a $50 deductible and the rest is covered at 100%. Urgent care visits have a $20 copay and then are covered at 100% at an in-network location. For most services, once the deductible has been met, the insurance company pays 80% of the negotiated charge and you are responsible for 20%. There is an unlimited benefit year maximum and your annual out-of-pocket maximum for coinsurance is $2,500. As I've noted, services at the Silver Acre Clinic are covered at 100% with no office visit copay once you've paid the Cal Wellness fee. After the deductible has been met, hospital medical services, ambulatory surgical centers, skilled nursing facilities, hospice care, and outpatient medical services and supplies are covered at 80%. Your share is 20% up to the $2,500 annual out-of-pocket maximum. Home health care and home infusion therapy are paid in the same manner. For a physician office visit, you only need to pay the $20 copay and do not have to meet the deductible for the visit. However, labs and x-ray services are subject to the deductible and 20% coinsurance. If you see a provider for preventive care and nothing else during a visit, there is no copay, coinsurance, or deductible to meet. Physical therapy, chiropractic care, and speech therapy are covered at 80% once the deductible has been met. Pregnancy and maternity care physician office visits are subject to a $20 copay. Acupuncture, TMJ disorder treatment, bariatric surgery, durable medical equipment, and mental or nervous disorders are covered at 80% for in- and outpatient care once the annual deductible has been met. Prescriptions are covered with a $10 copay for generics, $20 copay for brand name prescriptions, and $30 copay for non-formulary drugs. Need to know if your prescription is non-formulary? Call customer service at the phone number listed on the back of your card, or go to anthem.com/CA. Click Customer Care, download forms, and download the approved formulary drug list. We want your experience with the student health insurance plan to be a positive and easy one. If you feel like your claims aren't being paid correctly, need help understanding an explanation of benefit statement, or just need general guidance on how to use this plan, please contact us right away. We appreciate your feedback as we continuously try to improve the plan.